Talk to any of the Democrats who are running for president, and they'll tell you that they rarely field questions about the Mueller report or Russian election interference. Instead, they get questions about the issues, as evidenced by our exclusive Hill-Harris X poll, which shows that healthcare tops the list of priorities for voters: immigration, the economy and jobs, terrorism and national security, the environment, guns, and taxes rounding out the top 7. Breaking it down by party, Democrats and independents say that healthcare is #1, but that the #1 issue for Republicans is immigration. Next is healthcare.
And a new survey by Real Clear Opinion Research yielded some similar results, with healthcare most important for issues among voters. Folks there decided to dig a little deeper to see where America stands on healthcare. What do they think? And they came up with some pretty surprising results, actually. Joining us now is RealClearPolitics Washington Bureau Chief Carl Cannon to tell us more. Great to have you, Carl. Thanks for stopping by. We appreciate it. Interesting stuff in this poll.
Yeah. Carl, so you took a deep dive into the issue, and one of the things that you found was there's actually a bit of a disconnect on how Americans rate the quality of their own health care and what others receive. So 72% said that their health care is excellent or good, but only 44% feel that way about the health care that other Americans receive. How do you explain the discrepancy there?
Well, two things occurred to me, and I'd be interested in your thoughts, too. One of them,
we can all take our guess, right?
Yeah.
Well, one of them is that it's a partisan issue, and it's been a partisan issue now for a decade. And Democrats out on the 20, is it 22 now Democrats running for president?
Something like that, yeah.
They're either calling for Medicare for all, which is a term of art, and people aren't quite sure what it means, but it sounds
good.
People like it.
Yeah.
Or they're defending Obamacare. The Affordable Care Act, and they don't want to go that far with Medicare for all. They want to bolster Obamacare. The Republicans are still sort of stuck in this thing where they dismiss Medicare for all as socialized medicine, and they talk about, Obamacare as, remember, you were supposed to get to keep your doctor, and you didn't. So the two parties are talking kind of past each other, and so in a partisan environment, some voters know what they're supposed to say about
Yeah, well, and also
so that's
it's like
part of the disconnect. So
yeah. But neither side is arguing that the healthcare system is great, right? So people may feel like, okay, well, my healthcare is good, but everybody else's must be terrible, right?
That's the other thing I thought of that comes to this poll is Americans are still pretty altruistic. Even the 72% who like their healthcare, they're not sure that other people, are getting.
Right.
They're worried about the people who don't or don't have access to it.
Right.
And that to me is a positive sign that those numbers don't have to add.
That is interesting. You hear your friend's story about having, going broke or had this large bill, and you're like, well, that's terrible. That shouldn't happen to somebody. So I think I understand.
Yeah. Those are my thoughts.
Right.
You guys have anything?
Yeah, no, I think that makes sense.
Yeah.
Yeah, I mean, the discrepancy I think is interesting. I think it broadly goes to what you're talking about, where people say this isn't a system that we should have, even though it's okay for me, it's not great for everybody else. I think that really does get to the other result here, which I think is very interesting, which is that 96% say that the system is broken, not working well, or just good but not perfect, with only 4% saying that things are working well and no significant changes are needed. So that really does, I think, go to what we were talking about previously, which is that 96% agree something is wrong or it's fine and something could be improved.
Well, 96% of the people either think the system is okay, needs some tweaking, or is not great and really needs improving, but 28% basically said it's irredeemable.
Really?
They're open to radical differences, and and that's 7 times as many as people who really like it perfectly the way it is. So if you're looking at this and you're a politician, I don't know, Republican or Democrat, you think, all right, the public is open to change. The public is receptive to pretty serious change and more involvement by the government than Republican office holders might be comfortable with.
Yeah, interesting. Well, so let's look at when people talk about, okay, we need to fix healthcare, what are their priorities in that regard? Top priority is lowering the price. 55%, then you got 47% saying we got to get access for all Americans, 43% saying we've got to lower prescription drug prices. So not a huge difference there, but some very specific concerns, too, about what is wrong in our healthcare system.
Well, but also a partisan divide there. Not enormous, but significant. Democrats, their top concern is, these are registered Democrats in this poll, is expanding access.
Right.
Registered Republicans, they're about bringing down the cost of health care. Now, both groups care about both things, but they're different in priorities. Independents are right in the middle.
And what about the lowering prescription drug prices? Was that kind of a bipartisan deal?
Yeah, that is. And again, yeah, both groups care about it, but Republicans care about it more. And so what you have is, if you're looking at this, the Democratic electorate is ready for change that brings more people in the system.
Yeah.
They'd like to bring the cost down too.
Bleeding hearts. That's what we are.
Well, to that point, I mean, let's look at the Medicare for All results, which you found, which are pretty extraordinary. You have 65% who have come out in support, 27% who actually oppose.
It's pretty remarkable.
That's 2/3 who gave a thumbs up to the plan, but if you add the caveat that it would mean eliminating private health insurance, support actually drops by 10 points to only 55%.
Still majority support, though.
Right, so Carl, I mean, does that mean
that's a radical change?
Does a majority want to eliminate private health insurance?
Well, they say they do.
Right.
Yeah.
If I'm a Democratic candidate who's come out in favor of Medicare for all, and you've run for office, so you know what I mean. And your campaign consultants are saying, Crystal, don't get out over your skis on this.
Right.
You can look at this poll and say, well, okay, but the electorate's with me.
Right.
Now, so we asked Medicare for all, just in very brief discussion. This poll's done by John Della Volpe, very good pollster. I have to say that, but he is, for Real Clear Opinion Research, our third such poll, which we really try and dig deep into the things. And he defines it, Medicare for all, because the candidates don't define it. It's a nice, it's sort of nice talking point, kind of. Why improve it? People like it.
Right.
But he defined it. He said it would mean government control of health care. 2/3 of the people say yes. Then we asked the other question and add okay, but even if it means making private insurance go away. Yes, it dropped, but I agree with you. It's surprising how little it dropped. 55% still say yes. And so there's people who can take solace in that on the Democratic side. Now, what the Republicans will tell you in the Trump White House and in the Hill is, okay, but people don't really get this yet. They don't understand. This is going to be tremendously high cost. Now, I don't mean net cost of the healthcare system, but it's paid for in different ways now. But these are going to be tax dollars, and you're going to have a big tax increase. And when people see that tax increase, and when you beat them over the head in the cauldron of a campaign, you will not get to keep your doctor, and we'll be like Britain, and you'll have to wait 2 years for a knee replacement surgery or whatever they're going to say.
Right. They're going to dirty it up.
Some of it's true, some of it's exaggerated, but the taxes, then the support will decline. I'm sure that's true, but going into this, people are not undisposed to this idea, and if you favor it, you got to take solace in that.
What's interesting to me is, I'm sure, and you probably know that, I'm sure if you dig into the partisan numbers here, there's a big partisan split between Republicans and Democrats, but you can't get to 65% support on the back of Democrats alone. I wish you could, but you can't. So how has this issue avoided becoming completely partisan in the way that almost every other issue really has?
Well, Republicans are divided about 50-50 on it, so you're right.
Interesting.
But it's that old line, Michael Jordan was once asked to endorse a Democratic candidate. He's alleged to have quipped, well, Republicans buy tennis shoes too. Republicans go to the doctor too. And I think in some ways, although this has been a partisan issue, it's not a hyper-partisan or needlessly partisan issue. So the two parties actually have legitimate philosophical differences of approach. There's some good faith on both sides. And so I think when people are polled about this, they can actually say what they really think.
Yeah.
It's not simply sticking up for their tribe.
You also have the dynamic, Sagar, I wonder if you think this, where, the president has been kind of all over the map on healthcare. I mean, he ran his election on not Medicare for all, but on everybody's going to have healthcare. He basically ran to the left of Hillary Clinton on healthcare. So I think that has sent some confusing sort of partisan messaging too about where exactly people are supposed to be on this issue.
I don't know where the White House is on this issue either.
They don't know either.
Well, but this data shows you they're going to have to be somewhere on it. And I've talked to people in the White House. They know this. They're going to have. It reminded me, you guys are too young, but in 1992, when Bob Kerrey was running for president, healthcare was his there issue. It was all he talked about. And I went down to Little Rock. There was a governor there some people thought had promise. And I asked him about it. And there was a group of people, weekly editors, and he asked me from rural Arkansas papers. And Bill Clinton said, well, come to it. And and sit. And some guy asked him about health care. And Bill Clinton said, just out loud, using out loud, well, I suppose I'm going to have a policy on this because Kerry's running on it. He was very...
Guess I better say that's a very Beto O'Rourke kind of answer.
Well, and of course he came up with a plan after he was president.
Yeah.
But that reminded me of Donald Trump. I think it's dawned on they're going to have a policy.
They're going to have to figure it out. While we have you here, real quick before we let you go, we just did some polling here at the Hill and Harris X on abortion. This was before the very restrictive bill passed in Alabama last night that bans all abortions with very few exceptions, no exceptions for rape or incest. But we asked about laws banning abortions after 6 weeks, and the public was basically split. 45% said too restrictive, 34% just right, and 21% said too lenient, again, on banning abortions after 6 weeks. I mean, in your experience with the polling results that you've looked at, how does the public feel about this debate?
Well, two quick things, caveats to that before I say that. First of all, that law is not conformed to any of the decisions that the Supreme Court has rendered on this subject.
Right, and which is very intentional.
Right, we got into this earlier.
Well,
yeah, it's very intentional.
This is push it to the Supreme Court.
And it's so at odds that they want to be first in line, is what I'm guessing.
No, they've explicitly said that.
Yeah. Okay.
Yeah.
So, and you know, I won't get too graphic because children are watching, but I have 3 children. I can tell you, just as a matter of science, as fact, that not every woman knows she's pregnant after 6 weeks. So this is not a bill that's done anything intended to provoke another decision. But the polling is on this issue is neither party really speaks for the vast majority of Americans on this one issue. The Republican platform every 4 years is abortion is the taking of a human life, no exceptions for anything, and this is the Republican platform now, and federal judges should be appointed who agree with this view. That's their view. The Democratic view now, taking their cue from NARAL, is no. It's a decision strictly between a woman or doctor. It's nobody's business at all. It's no more utility to the state than getting your wisdom teeth removed. These are two views that, by definition, are, I won't say extreme, but they're pretty absolute. 80% of Americans are in the middle. They think it's a difficult issue. They don't understand how politicians can pretend that there's not compelling arguments on both sides.
Yeah.
And so the polling on this reflects the innate wisdom of the American people, and the problem when you let special interests drive politics.
Very true. I mean,
those are my thoughts.
My experience is very much what you're saying, that the party that is doing better on this issue is the party that is looking less extreme on this issue. So when we're talking about, abortion in the 3rd trimester, right? Democrats are losing.
Right.
When we're talking about forcing women to bear their rapist babies, Republicans are losing because people are uncomfortable. They don't mostly have these absolutist views, as you put it. So
most Americans, we saw this on the poll on healthcare, are pretty reasonable.
Yes.
You wouldn't know it if you only watched cable TV. You'd know it if you watched this show.
Just don't go on Twitter.
Or
That'll just ruin all your faith in humanity.
I'm honored to be thought of as reasonable.
or read RealClearPolitics.
Yeah.
And if you do those 2 things, you're probably okay.
There you go. Carl, thanks so much. Really
Carl.
interesting results. Thanks for digging into this stuff. People need to know where the American people stand. We appreciate it.
Thanks for having me.
Coming up, stage is set, as we were just saying, for a Supreme Court battle over Roe versus Wade. And Elizabeth Warren says thank you next to Fox News.
So Joe Biden's bipartisan epiphany has raised some eyebrows, and 3 radio stations promise to make sure that their listeners hear the president daily until Election Day, when Rising continues.
Let's